Hello. I'm Dr. Veerapandian. I'm joined by Dr. Sam McKinsey from University of Rochester here. We want to talk about our exon skipping agents, especially exon this 51 eteplirsen. How we don't have long-term data on eteplirsen, especially focusing on cardiac or respiratory outcomes. But we did have some at the recent MDA meeting. I'm curious what your thoughts on those cardiac outcomes with eteplirsen that was presented.
Yeah, well, I would echo your sentiment on not having a lot of data to support eteplirsen in terms of cardiac profiles. So these were really nice data to see. So what I think was done here, they pooled all of the prior trials with using eteplirsen and came up with a cohort of 122 patients here that you can see in each of these graphs on the left. And those patients that are on eteplirsen or were on eteplirsen are in green, and the blue line represents a age matched, propensity matched natural history cohort, and you can see that they trend a little bit quicker downwards than our green lines do. So, just looking, left ventricular ejection fraction of 50% for our first plot here. You can see that this is sort of a survival plot. So when a patient dips below that threshold, that's evident. And you can see that our eteplirsen treated really never got there over the span of time that they were studying. Yeah, so I'm curious about your thoughts as well. I mean, is this something you expected?
No, I think this is encouraging to see this, even though we don't measure these or assess these in a standardized way in the real world clinical setting. I do think that some of these cardiac functions get stabilized in these patients, and none of our patients want to get off of the medicine. If I ask them, if we discuss with that, one thing I kind of struggle not just here is comparing with the natural history cohort, so natural history data, right? What's your thoughts on the control group that was used here and how well matched, especially in terms of the cardiac medications that are now being used as standard of care?
Well, I think that's a really important point. The natural history of Duchenne is certainly always evolving, and we're doing a better job with some of those cardiac medications like ACE inhibitors, ARBs, doing a better job at making sure patients are getting the appropriate nocturnal ventilation, right? So reducing some of that cardiac strain. I think it's always ideal if we have a real world contemporaneous control group that we can extract these data from. But on the other hand, this is better than nothing. And there's a lot of work that's being done to, again, age match, propensity match, and make sure that these patients are paired as closely as possible with the treatment group.
I agree. I think it's always good to have this when I show to patients or even to the payers when they ask about treatment effects and continued treatment for some of our patients.
Just one more thing to note as well. We talked about the benefit here, and just to talk about the decline rate in numbers in number terms. So we have for left ventricular ejection fraction, which is I think the outcome most of us non-cardiologists kind of track. That number in the eteplirsen group was 0.66% decrease per year. The natural history group 1.38% per year. And you can see, on the plot to the right, we still get a progression of disease. So I don't think any of us expected that this was going to be curative or stabilizing, but it does slow progression, which is nice to see.